Okay, so today is my first day of shadowing. As you can tell, I do not look ready at all. Yeah, I think I'm just like nervous and procrastinating because they said I didn't have to go in. I mean, I just needed to come in for a couple hours to shadow, so I'm gonna go soon. But first I'll do my hair, you know? I'm nervous. Right now we're getting ready for work. Right, Renman? Oh, lucky. Just kidding. You get to go to work with me too. Woo! Yeah, I know. I'm like nervous and just doing weird things and freaking out. So, okay, don't get burnt by the curling iron, because then you're really gonna have to be a patient today. My first patient, my own dog. All right, I think I look a little more presentable now, right? Dr.Kristi coming. Oh no, is this scary? Help. Babe, is my bun okay?
Sexy. Very delicious stuff. Bunalicious.
Ready for work. Yeah! Babe, how many times do you think I'll cry in this first year as a vet?
30,000.
I don't know how many cries that is in a whole year. Like, if it's like, is that wait, that's a lot.
Yeah.
Wait, because if there's 365 days in a year, I'm crying a lot per day.
Yeah. Tears.
It's the year of tears.
Joy, though. Tears of joy.
Oh, okay. Okay, guys, so like today, I clarified with my boss, and he was like, okay, actually, like this week you're just shadowing, which is great. And so I thought I thought July 1st was kind of gonna be like the real thing, but not the real thing. But it is kind of, I'm rambling because I'm nervous to go in. But yeah, he's like, just come in for a couple hours today. So I'm like waiting on furniture and stuff. So I decided to go in the afternoon, but I'm about to go in like 20 minutes. But like I had to get a little snack, you know? And I went to McDonald's. I know, like, I'm trying to, like, be healthier, but it's hard when you're, like, yeah, moving, whatever. I'm making excuses. But I went to get my Filet-O-Fish. Don't judge me, first of all, for that. And then I go up to the window, and then the lady's like, the person in front of you paid for you. And I was like, today is my lucky day. It's going to be a good day. If someone paid for my Filet-O-Fish, you know it's going to be a good day, right? And then I was like so pumped up and like, oh my God, this is so nice. And like kind of drove off. And then I was like, oh shit, I probably should have paid for the person behind me, like paying it forward. So this is my like accountability, like hold me accountable. I'm going to pay for someone's McDonald's one day. Oh yeah. Like, cause that's all I could probably afford right now. Yeah. Until I get my paycheck. Okay. Yeah. I'm going to eat my food and check in later. First day jitters. First day jitters. Okay, today's the real first day. I take clients today. So we're just getting ready. So yeah. All right, so today marks day 2 of doctoring. I had a day off on Tuesday, so obviously started Monday, day off Tuesday. Today was my second full day. Went from having like maybe 3 appointments on Monday to having like maybe 12 or 13 today, and it was really cool. I'm picking it up. I think half the battle is like the computer system and like records and like knowing what to do in real life for school. But you know, I thought today I was like, okay, I'm gonna have like a bunch of vaccine appointments, but I did. But it was nice because I actually had some sick appointments too, which freaked me out at first, but it all ended up okay. Had some like diarrhea, had some, a patient that had some, like, wow, my brain is like farting out, mobility issues. So we did some rads and all that. And then I think my most like nerve-wracking one today was a patient coming in that had been having seizures for the last 24 hours and actually had an active seizure walking into the lobby. So, had to think fast on my feet, but also all the mentors I had like at the clinic, all the vets are super helpful. Will always go over a plan with me right off the bat, so we can like compare thoughts and have just great advice and even some client communication tips. So So overall, been extremely helpful. I will tune you guys in on tomorrow. Okay guys, so I am done with my first week of being a doctor. Crazy. Yeah, these like impromptu like updates are gonna be just, you know, whenever I feel. Right now, it's always usually when I'm taking Ren to go to the bathroom, but I like want to give you guys updates when I remember it in real time. But today was definitely like my favorite day, and obviously it's like the end of the week. I'm getting the hang of things more, but I started off the appointment with an awesome client, I hope you're watching, who is a human physician. She's so awesome. Had the cutest puppy come in. We just got to bond, talk about like, you know, her job, my job. You know, we're new to the area, so she knew I was a new grad, totally supported it. And I don't know, it just made me feel better, because I know sometimes like clients might not want a new grad because they think we don't know anything, and you know what, we do know a lot of things. That's what I'm realizing. We just got to get into the routine of, you know, doing the real world stuff. So, you know, we have the medicine, we have the knowledge. It just comes down to getting the mentorship to like help you put it all in place. And she knows that because she went through med school and stuff too. So she was like, oh my God, I love new grads. You know, she's like new to the area, starting a new job, but she was so awesome. And I was like, it just started my day off so well today. So I really loved that. And then today I just felt like I was better with the computer system. I was a little better with, you know, maybe efficiency, and I was trying to help out others too. I really sucked at blood draws today. But, you know, just something to get better at, right? We had, I don't know, I think I've already seen a ton of cases today, and, you know, my expectation was, I kind of just thought, you know, like, you know, they warned me, they were like, we're going to ease you into things, we're going to do, you know, more vaccinations and stuff, but this was literally a crazy week for the clinic. They're super busy, so I was glad to, like, get some challenging cases, a lot of sick patients, some emergencies, so I was actually really grateful that I was able to do those, because it's so great. It's just so great to see like what we learned in school, like we do know in practice. I mean, and granted, yeah, I did ask for help. I did like have people check me, just because the patient safety and well-being is my number one priority. So, you know, like I truly don't have like a problem asking people for help in general, but you know, like I have an amount of I just feel like I have, you know, pride. I'm sorry, I had like a brain fart. I'm prideful and stuff, but like I'm not embarrassed to ask for help and for people to tell me that, you know, maybe we should do a different treatment plan, because in the end it's all coming down to the safety of my patients, and that comes first before pride. So I would like to, you know, tell all new grads that who will watch this now or in the future, that always, you know, double check if you're not sure, look it up, because like these are your patients. You should be the number one advocate and only giving them, you know, the best treatment that you can give for, you know, what they're there for. So today was my favorite day, and we had like a staff meeting, and so it was great to like see kind of how the clinic works, you know, sharing, always talking about the core values at each meeting. And I remember this when I externed with them too, they did that, and it was really cool. And then talking about like suggestions, like every single person on the team gets to have a suggestion on something they think the clinic can improve on. And so I think that's really great. Yeah, so I'm just like sitting in the grass, and all these cars are probably like, why is she like videotaping herself? But anyways, the client meeting was awesome. I don't know, I just truly feel grateful for having this job. There wasn't one day this week where I wasn't excited to come in. Yeah, I've been a little scared, but like, I don't know, let it fuel you. So I really liked it. I really liked it a lot, and I just feel like with every visit, I'm just becoming a better doctor, you know, better communicator. It's fun. It's fun, challenging, it's awesome. I think this was like, having this first week of just being at my clinic was the reassurance I needed that like I did pick the right profession. So, you know, I'm happy. So I'll get to answering you guys' questions about like life as a new grad in my first week, because I promised, and you guys asked some awesome ones on Instagram, so we're gonna be going through those, so you don't want to miss it. No, but okay, the reason I said that though about like taking your work home with you, you know, in vet med, it's because like, you know, I've had people tell me that, you know, you always think about these patients, you know, at night or something. And like just now I was thinking about my one patient this week that had a seizure, and like how scared his dad was. And I just, I've checked him, but I'm just like wondering how he's doing. I'm definitely gonna follow up on Monday. But I'm just like, now I know why people say like you'll always take your work home with you. I always told myself I'd be like, oh no, I'm gonna like, leave it with me after I leave the doors, at 7.
Yeah, I remember you when you obviously like first like it started setting in basically that you're about to be going to Chicago to be like a vet. Like obviously you accepted the job offer and whatever, but like it was actually setting in. And I remember you like, as soon as I get out of there, like I'm not going back at 3 a.m. like da da da. I'm like, yeah, there's gonna be days where like you're not gonna have a choice.
Yeah.
And so honestly, like I would never advise this, but I'm just like, shit, if on days you don't have to go in, I wouldn't go in.
Oh yeah, no.
Because you need to have a work-life balance.
I agree. I definitely agree. Like it's great to like start advancing your, it's great to like see more stuff and advance your skills, but like also I need to like have a life,
Yeah.
or just like it needs to be more than vet med only too. So I'm like, it'll be interesting creating those boundaries for myself, because like I'm sitting here like enjoying your birthday weekend, and I'm like sitting here thinking about my patient that had a seizure and like if he's okay,
Yeah.
Okay, as promised, I'm going to go through the questions that you guys asked me on my Instagram question poll thing about my first week. So it's gonna be kind of like a rapid fire question. And also, I know I promised I'd answer all of them. There was actually a lot, and I condensed a lot of them into the same kind of message or whatever question, because a lot of them were similar. But for those that didn't really relate to my like first week, such as like stuff for NAVLE, I'm not gonna talk about those questions. So if you want to know about the NAVLE stuff, just check out my past YouTube videos. Okay, all right, so first one, was I nervous, anxious? Absolutely, yes. It was kind of like a weird, didn't know how to contain it, so I just went in to the clinic like excited but like nervous, and just saying I was nervous, and then just like kind of wandering aimlessly. So yes, I was anxious as well the night before, but it all worked out, right? How overwhelmed prepared were you? Overwhelmed a lot, because I was like, what do I know from vet school? I don't remember. I do think vet school does prepare us, believe it or not. It builds that foundation. And I was very overwhelmed, because I was like, oh my gosh, I don't even feel like I remember the basics. But they do come back to you, I promise. Points you felt inadequate or failed. So the thing about the failing points, I feel like I failed. I don't ever think I failed yet. This is weird, and this is like the mindset you have to remember is like you're not in vet school anymore where you're tested over every single thing. Like, yes, each appointment is like, I guess, a test in itself. And I'd say like, I would say I would failed if I left that exam thinking like I didn't give the owner a good experience. And yes, I know there's so much more I can do. I think I can be more organized in my thoughts and communication. But I do feel like for my vaccine appointments that I saw the first week, like I was, giving them the information. I was giving them my attention and enthusiasm. So I don't feel like I've necessarily failed anything yet. In regards to like my patients and all that, inadequate, definitely feel inadequate all the time, but that's why I have great mentors on my side, and I'll get to some of those questions that relate to that. How do you transition from student to doctor? It's an ongoing transition. It's not just like day one, all of a sudden you're like, I am Dr. Kristi, and here I am, like, hear me roar, I'm gonna just throw all the diagnostics and differentials, and I know everything. It's like an evolution, so actually right now as I'm filming this video, I'm already like towards the end of my second week. I got really behind on making this video, but I just feel like second week I feel more like a doctor. I feel like I can help delegate things I need the technicians help with. I can communicate disease processes better with clients. I can talk about treatments without making all about money consciousness, and like I just feel like I can direct the conversation way better this week. So the transition is it just comes with time, but I'm feeling like every day it's getting a little better. Yeah. How does mentorship look like at your clinic? Do you have to ask a lot of questions? How are your coworkers, colleagues so far? All these kind of questions I'm like putting into this answer. So my mentorship at my practice looks like, so there's 5 other doctors, not including me. And so I'm always at least on, the floor with 2 other doctors. And so if there's a case I feel, like I need some second opinions on, I absolutely ask them before and after and during. They are so helpful, so open. I have not felt like they were annoyed by me. I felt like I'm annoying when I ask them questions because I can ask them things, about anything, even things I know, but I just want to double check. And they're like, yes, no, ask away. Like, they're so awesome and helpful. And they help me navigate some of the challenging cases I get, because now I'm getting more sick patients. So, before I go in the room, I'm like, hey, look, this is what I'm thinking, and the doctors will be like, even that's, good thoughts, maybe let's get you some more ideas. So it's really awesome. But I get to hear their spiels on what they would do. I get to, consider what I was thinking to doing. And I think sometimes I just combine them. Sometimes I do mine, sometimes I do theirs. But so far it's really worked out really well. My mentorship also is kind of a little bit more structured than I know a lot of places probably are. I have Dr. Adam, who owns the practice, and he kind of mentors me on the fly whenever he's there and he wants to talk about diseases and cases. We go to lunch and stuff to talk about that. But Dr. Andrea, she is my more structured mentor. So, we sit down together, we talk about different goals, my goals for, months 1, 3, 6, stuff like that. But we also talk about, just different topics. So yesterday, we sat down and talked about kind of my knowledge on stuff in the clinic. And it's not like testing at school, like in the clinics, but she's asking me, okay, so what is the difference between a senior and a junior wellness package at our clinic? And it's just checking in with me to make sure I'm understanding costs, I'm understanding how things work. And later we'll get into the more disease and medicine processes, but it's great because I always get to check in with my mentors. They're always there, and they're always checking in on me. And so it's really nice. And my coworkers, everyone else is super fantastic. The techs are hilarious. They're fun to work with. I mean, yeah, they give me shit because I'm the new grad, but it's all in good fun and it's great. So far I'm loving it. Any challenging, crazy cases that challenged you? Yes. I kind of internally was freaking out when I had my seizure case because actually I never had a seizure case at school. The time where I would have probably seen it was on ECC, but I couldn't take that rotation because of COVID. And I didn't take neuro or anything like that. So I never really had a seizure patient, but one of the vets who actually is a year out, so she's was the new grad. Now I'm the new grad, but she really helped me with the case and she rocked it helping me, and so it was super awesome. What is it like being in charge of the patient, you're the sole person? It's honestly cool. It's scary and terrifying, but it gives you this added responsibility that you kind of feel empowered, and you just feel like an advocate for your patient. I know a lot of people probably feel extremely stressed and stuff, and I do agree. If you saw the beginning of this video, you can see that I often think about my patients on the weekend, and I told myself I wouldn't be that person, but it's inevitable, really, especially as a new grad, because you're is there something I could have done? And I always ask my mentors, I'm could I have done more? And they're all you did exactly what we would have done. So how do they schedule your appointments? Do you feel like you have enough time? So it's awesome. So my first week, the first day, I had just some vaccine appointments, and I had 30-minute appointments. So, they gave me double the time, where usually they're 15-minute appointments. So they give me double the time to, adequately talk about it, do the vaccines. The thing that's different about, vet school and the clinic I'm working at, and I think most GP clinics, is you're not always going to have someone restraining for you in the room. So I was really nervous about vaccinating dogs, just me poking them without someone holding them. And we were told in school never to trust the owner with restraining, which I think still is kind of true. But honestly, after you get a couple under your belt, you kind of find ways to maneuver to, give vaccinations where the animals don't even are just so unbothered. So that's been helpful. But yeah, now I'm finally getting some sick appointments during week 2. Again, I know this is overlapping a little, but those appointments I get a little bit longer too. But towards the end of my first week, I want to be proficient and efficient, and so I always try to be aware of my time, but be very educational in the room. I want the owners to feel like they're getting good value out of our interaction, and I always try to cut my appointments short before the time they allowed me, so I can have time for my notes right after and all that. Do you feel like vet school prepared you to make independent decisions? Yes and no. I think it's like, I don't know, it's hard to say. I feel like yes, but I feel like no, because a lot of times in vet school, like we don't necessarily get to come up with the plan ourselves. So like it's all just kind of trial and error, like just getting used to how you do come up with the plan yourself. That's truly your plan, not one that, you know, some of your blockmates helped with or your clinicians kind of hinted at. So it's been interesting. But I do feel like vet school prepared me to be where I am today. So any tips for how to prepare, spend my days up to my new job, like as a new grad? What I would say is definitely shadow a couple days before you start. Shadow and get into some appointments with other veterinarians and kind of hear some of their spiels they talk about, how they talk to clients. It was super helpful because things are not truly as complicated as like we make them seem in vet school. And I'll talk about this in like future videos and vlogs. Like I want to share some of like the talks I have with my clients in regards to like allergies, vaccines, you know, diarrhea. Like when I think, oh my God, this dog's having diarrhea, I'm like, oh my God, thinking of every differential under the sun. When really there's like, you know, 3 really main things that it probably is. Like initially, yes, you can have the wild cases that you end up referring to the specialty hospitals, but in future videos, we'll talk more about that. But I would say definitely shadowing some of the vets that you work with, and also just writing down the medications that they have at the clinic and just studying those and being familiar with those and when you would use them and when you wouldn't use them. And also, like, if you make yourself a little chart with those drugs that they have, just ask the vets, like, hey, when would I use, like, Otamax? When would I do this? So that's what I would recommend because that helped me a lot. That's what I did. How do clients respond to you as a new doctor? So I've only had 2 clients that knew I was a new doctor. One, because like I became friends with one of my clients in the room, which was awesome. She is fantastic. And she, you know, just asked about where I graduate or like where I grew up, where I went to school. You know, we had a great little visit with her puppy. And then, you know, she's a human physician. So then, you know, I was like, felt comfortable telling her, and she's, you know, she was awesome. She's like, I love new grads. Like, so that was awesome. And then I actually, I had another client who realized I was a new grad at the end because she's a regular at the clinic, so she's never seen me. But, you know, I went into that appointment super confident in what I was doing. I feel like I got my allergy talked down, so I was talking to her about that. And, I was talking to her about, like, you know, what I think the medical treatment should be and what we're going to do and stuff like that. I went in confidently, and, you know, by the end of the visit, she, you know, then asked me, oh, are you a new doctor and stuff like that, blah, blah, blah. And she, you know, told me, so I ended up telling her I just graduated from Purdue and this and that. And she was like, you are awesome. Like, everyone's so awesome here. You're doing great. Like, you know, we enjoyed having you. So I haven't had people ask if I'm a new grad, because why would you don't have to tell them that. Just go in an exam room, rock it. Doesn't matter if you're new or old, because all that matters is that patient is getting quality care. So that's why I'm like, I don't think clinics, like if they're introducing a new doctor, should necessarily say when they graduated, because I'm sure there are clients that would rather not have a vet that's newly graduated, but also there's clients that I don't even think like know or think that they'd probably even get better care, because clients don't necessarily know like us new grads are coming out freaking out, you know what I mean? So just rock it and be confident. How have you been learning the new computer system? Our practice uses eVet. I don't know what everyone else uses, but it was challenging at first. But honestly, the more every appointment you do, you're learning something new. You're remembering how to input it. You're doing this. Yes, like it's week 2 now that I'm answering these questions now, and I'm almost done with week 2. And there's still some charges I forget to add, or I put the wrong thing in because it's part of some certain wellness package, and it's confusing. But every day I'm learning a little bit more, and I'm feeling more confident and being more efficient. So that's great. Are you exhausted already? Yes. Like in a good way though. I work many 12-hour days. So my schedule on Monday is 8 to 7:30 p.m. I get a lunch break. Tuesday I'm off. Wednesday I work 8 to 7 p.m. Get a lunch break. Thursday I work 8 a.m. to noon. That's a half day. Friday I work 8 a.m. to 7 p.m. And then I work every other Saturday, which is 8 to 2, and one Sunday a month, which is 10 to 1. And right now I'm working probably more Sundays than I will in the future, just because they want me to get used to it and shadow and all that. So I am exhausted, but it's awesome because I like come back at the end of the day being like, wow, like I'm proud of myself and this is awesome. So yeah, that's kind of just the gist of a lot of the questions I got. I try to summarize them so this video itself for the questions wouldn't be a trillion years long. So yeah, hope you enjoyed. All right, guys, and stay tuned for episode number 2 of Dr. Kristi. I don't even know if that's what I'm going to call these series, but week 2 was way more interesting, and I actually filmed stuff in the clinic. And I think with each week it's going to be better because I'm going to feel more comfortable, and I'm going to share things that, you know, I'm like, oh man, I wish I would have known this. So if any of you guys are going to be future new grads out there or just like to watch me say weird things and struggle and all that, just keep watching these videos.